Very good evening, friends. Meeting again in the session of Robert's philosophy, and we have finished two important miasm. We have finished the Sora. The four chapters are devoted for the Soric miasm by Robert. Then we have discussed syphilitic in length. The first chapter related with the syphilitic miasm, the manifestations right from the head to toe. Then second chapter of syphilis, that is the comparison between the syphilitic miasm in relation with the sorosyphilitic, that is tubercular miasm. And third chapter, yesterday we have finished one more where he has mentioned one more postulate as of a Robert, that higher the atomic weight of the element, more syphilitic is the remedy. So he has dedicated total 7 chapters for Sora and syphilitic miasm. Today we're going to start with third miasm, that is the psychosis, that is chapter number 29 from the H.A.Robert's philosophy. So chapter number 29, disease classification, psychosis. We'll start with it. Psychosis is generally understood to be gonorrheal poison. We should make the distinction clear between gonorrhea and psychosis. Gonorrhea is the acute infection of gonococci. Gonorrhea is an acute infection of the gonococci which takes from 5 to 10 days to develop the urethritis after an exposure. During this incubation period, it is purely an infection. Then the local manifestations are thrown outward by nature at the point of attack as a resentment of vital energy to the infection. If gonorrhea is thoroughly and completely cured, practically no psychosis ever develops. See, in this first paragraph only, Robert explains the concept. Even Kent has mentioned the same thing. Hahnemann was the first one who labeled that gonorrhea is of two types. The first is acute, which behaves as an acute manifestation caused because of Neisseria gonorrhea as an acute disease. It remains for 5 to 10 days, throws away the yellowish mucopurulent discharge either from male or female urethra, and it vanishes and it leaves the disease without producing constitutional symptoms of the gonorrhea. That gonorrhea is an acute, which is not chronic, and which will not develop psychosis. The second variety, which was recognized by Hahnemann, he was the first one to find it out, the chronic gonorrhea. The gonorrhea in which, along with this yellowish mucopurulent discharge from the urethra, there happens to be a constitutional features. It develops the fig warts around the genitals. These are cauliflower-like warts, which are called as genital warts or which are also called as fig warts. And though this chronic gonorrhea, when suppressed, is responsible to produce the psychosis. So we must be very clear whether gonorrhea is of acute or whether gonorrhea is of a chronic origin. If gonorrhea is thoroughly and completely cured, practically no psychosis ever develops. Psychosis is established after suppressed gonorrhea. When the acute infection is driven in upon the vital energy by external methods of suppression, and it then becomes systematic stigmata, permeating every living cell of the organism and transmitting its deadly destructive forces to the offsprings, as well as retaining the full destructiveness of its power in the original individual and impregnating the mother of the child. See, he is very clear regarding things. When this gonorrhea, which is constitutional chronic, when gets suppressed by local measures, or these pigwords which appears over there, if you remove them by cauterization or either acid cautery, electrical cautery, or you have removed them by surgical measures, this external manifestation disappears and then it involves the internal vital organs. Generally, the psychosis develops soft tissues or affects the soft tissue. And that's why psychosis more commonly affects the glands. It affects generally in case of females, specifically the pelvic inflammatory diseases. There is affection of the ovaries, there is the affection of the fallopian tubes, there is an affection of the uterus, and endometriosis, the ovarian cyst, the salpingitis, many more, and there is severe leukorrhea, all those typical manifestations which develops generally attacks female genital system. So it goes into the soft tissues more commonly. The syphilis goes into the hard tissue bony level. This is the big difference between two miasm. In syphilis, it enters inside, affects soft tissues. In psychosis, it affects soft tissue. In case of syphilis, it affects the bony structure. So this is how it goes. And this is the miasm which is transmitted transplacentally. It goes to the pregnant. If it appears to be there in pregnant woman, it affects the child also and producing certain structural damage even in the child also. So these two miasms, the syphilis and psychosis, venereal miasm, are dangerous miasms. Second important thing one must know that both the miasms, syphilis and psychosis, are transmitted sexually. So their partner who are not having any disease and one of the partner is having a disease even in latent phase is transmitted in the same phase to the partner. This is true with syphilis, this is true with psychosis. And that's why one must know this, that why a girl who is absolutely healthy before marriage, all of a sudden, within a span of 1 year, develops a pathology which was not there at all. This is because either she has engrafted the psychosis from her husband, or either she has engrafted the syphilitic miasm from her husband, and all of a sudden she becomes developed pathology, and these are the reasons which allopathy cannot explain. We must know all those things. There are many patients comes to us. I am treating one patient. She was absolutely healthy. Just now I am treating her. She was absolutely healthy. She was sportsman, not having any disease at all till marriage. And after marriage, she had all of a sudden the problems in the heart. She was getting breathless. So she has shown to the mm, heart specialist. He diagnosed that she is having cardiomyopathy. And he said, you don't have to run. You don't take chance of pregnancy. Even she was pregnant. They asked her to abort that pregnancy. She aborted. And they said that we cannot do anything because your heart is not working properly. It doesn't have a strength. How it has developed? Before marriage, she was a sports player, never had a breathlessness at all. And all of a sudden, after marriage, within 1 year, she developed cardiomyopathy. This means that she has engrafted the syphilitic miasm in the latent phase which the husband was having. So latent phase husband was not having symptoms, but just after marriage, within a certain period, she developed directly a quaternary syphilis, producing cardiomyopathy and producing a pathological disorder. So this can be explained only with the help of understanding of miasms, which is not possible for the allopaths. They said this can happen. We don't know how this happens. We know how this happens. This is the big difference. We have to understand all those things when we learn the miasm, and then we can answer many questions if we understand the miasms clearly. So in this specific chapter, we're going to learn such many things. What he says further, the suppressed gonorrheal infection is very apt to first show itself in the attacking the blood and producing an anemic condition, and general catarrhal condition is set up. Anemia is one of the important manifestation of this specific miasm. One of them. So it goes inside and affects the RBCs, producing anemia. Oftentimes, an inflammatory rheumatism develops. Second important attack is on bones, joints specifically, and inflammatory rheumatism. Always keep it in your mind. Rheumatism, rheumatoid arthritis is always psychotic to start with. Inflammation follows in the soft tissues and changes in the fiber of muscles. So it affects the muscles, it affects the soft tissues. That's why in pelvic inflammatory area, all soft tissues gets involved. Then it affects the lungs also,
Totally.
soft tissue. Lungs also a soft tissue and affect produces asthma over there. So this is very important thing which one must know. Where exactly the psychosis goes and where exactly syphilis goes, where the sora goes. If we understand this, then we can understand what will be the, if we give a very proper remedy, how it goes in a according to Hering's law of direction of cure in the reverse order. In fact, the whole organism becomes involved. Sometimes a stasis develops in the lymphatics. This is again one important area where psychosis enters. It blocks the lymphatics. So sometimes stasis develops in the lymphatics. There is swelling of the in the groin following separation and inflammation in the prostatic gland. Prostate enlargement is again a psychotic. Breast fibroadenomas, again a psychotic entity. Uterine fibroids, again a psychotic entity. We must know all those things. These are very important to understand. And how it runs. So he is explaining exactly where this suppressed gonorrhea or suppressed pigworms goes. It goes in these places. These are the symptoms that are first produced after suppression, showing that whole organism is involved and in the grip of this destructive force. Swelldom, do we get these constitutional symptoms when the initial gonorrhea is cured by the homeopathically indicated remedy? And if there is any constitutional taint, it is in the mild form. If the gonorrhea was not suppressed, if that gonorrhea was treated with homeopathic remedy, and if you treat it properly, then definitely you will not, your patient will not suffer from the secondary symptoms of the psychosis. Patient, if at all it develops, it is very milder form and you can treat it very easily. But it never happens if you treat it with proper acute homeopathic remedy or even chronic homeopathic remedy. So this is very important thing one must know. Second thing, which he explains over there, the transmission of gonorrheal problem, taint or poison or psychosis poison, as the case may be, is transmitted in the stage into which the infective individual has arrived. Just now I have told the same thing. In whatever state the first partner is having the disease, the same state it transmits to the next person. If it is hidden in first person, it will be transmitted in the same stage and all of a sudden the partner can get disease. If it is true, if it is a true gonorrheal infection, true gonorrhea will be transmitted. If it has reached the secondary stage, which usually comes on 3 months after the first stage has subsided and may be delayed to a full year, the contracting party will develop the condition at the same stage as the infector. This paragraph you highlight, this is very important. If you are dealing with the patients, just ask them regarding the history, but you have to ask it very cautiously because one can get hurt because of such types of questions. So it should be, you must understand it or perceive it. That will be a better solution. If you know patient when your patient is quite confident about you, then you must ask such types of questions to the husband in privacy, that whether you had suffered from such type of infections earlier, and you can get the answer. Many times you get the real answers, and you then it becomes rather simple for you to treat. But even though patient has, no patient will directly tell you the truth. There are very few who tells you the truth, and that's why many times it happens that you never get that proper history. But even though it has not got, still you can think in that direction and you can prescribe, because rheumatism, asthma, these are not the entities which all of a sudden develops. It has a miasm in background, and that is the psychotic miasm. Specifically, it has been engrafted. If the patient has married, then you can catch it very easily that this has been engrafted, because within span of few months or few days, it immediately develops. It indicates that it is engraftation of this specific miasm from husband. The secondary and tertiary symptoms of psychosis can be entirely eradicated by homeopathic treatment. So, if a patient who suffers from rheumatism after the first separation, then you find it out a right remedy. For example, patient is suffering from rheumatism and you have selected a complete antipsychotic remedy which covers the whole case. It might be thuja, it might be natrum sulp, it might be medorinum, it might be anything which is psychotic in background. And if you treat it, then patient will land into the first primary stage and patient will be recovered. If that lady who never had a primary psychosis, primary gonorrhea, but from her husband she got it in secondary stage, then she will not develop a gonorrheal discharge. Then she will develop a leukorrhea, an abnormal discharge, and that abnormal discharge, after that abnormal discharge, she felt better up for the rheumatism, and this confirms the diagnosis that patient is having psychosis. Both venereal miasm, there is one symptom one should not forget: abnormal discharges ameliorates. With SORA, it is normal discharges ameliorates. With psychosis and syphilis, it is the abnormal discharges ameliorates. So that lady who never had a primary gonorrhea will not develop a gonorrhea. She will better develop the such types of discharges and she feels better. And if even at the secondary level, this rheumatism, if got suppressed with the help of allopathic medicine, many times they give the penicillin, and they give along with that anti-inflammatory remedies, and if it never suffices, then they used to use the steroids, and if it is suppressed, the patient can land into rheumatic heart diseases, the tertiary level of the psychosis. So primary level was gonorrhea, the secondary level was rheumatism, and tertiary level was rheumatic heart disease. Now, in this stage also, we have ample remedies to bring those patients again into the norm. Anyone knows which are the remedies which we can use in this stage? Any idea? Which has directly a rheumatic heart disease. There are two important.
Adonis.
There are
Adonis.
Adonis is good, but Adonis is not that well proved remedy. We have a lithium carb, very important remedy. Second remedy is Calmia latiafolia. That is another second remedy which covers the rheumatic heart disease. Third remedy is Naja, tripodonts, rheumatic heart disease, rheumatic valvular heart diseases. So the tertiary stage, again you can bring rheumatism, and again after treating rheumatism, you can bring a primary gonorrhea, or if it is not there at all, the abnormal discharge in the form of leukorrhea or nasal or expectoration, nasal secretions or abnormal secretions in the form of expectoration that will be developed over there. So this sentence is very important. The secondary and tertiary symptoms of psychosis can be entirely eradicated with the help of homeopathic treatment. So one must understand that. We'll read another paragraph. In the secondary period of psychosis, almost every disease that may arise takes on an inflammatory nature in some form. It may be acute, subacute, or chronic, and it may vary from very mild to very malignant fevers. So, in secondary stages, many varieties of disorders develop. It might develop asthma, it might develop hemorrhoids, it might develop rheumatism, it might develop, as he has said, the malignant fevers, long lasting fevers. It may enter anywhere and it produces its effects. So we must understand where exactly the psychosis runs. It goes inside and generally produces the acute inflammatory or subacute or chronic inflammatory disorder. When it develops, generally you get many more autoimmune disorders which develops in this miasm. Psychotic miasm, the autoimmune disorders to start with are always psychotic in origin. They ends with syphilitic miasm, but with destruction. But to start, they are always psychotic over there. So it's better to stop over here. We'll continue with tomorrow with the same miasm, the next part, and we'll learn the clinical aspects of it so that it will be quite useful for you. So thank you being there, and we'll meet tomorrow at the same time with the same chapter. Okay. Good
Thank you
evening.
very much, sir.
Yes.